I'd be happy, Mr. Chair and members. Thank you. This bill is sponsored by the California Nurses Association to address problems associated with a growing trend to patients being treated under observation status for extended periods of time. This bill requires hospitals to provide notice to patients who have been placed in observation status that they are receiving service as an outpatient and that this may affect insurance reimbursements. Additionally, the bill ensures observation services continue to meet existing staffing requirements. I have with me Stephanie Robertson on behalf of the California Nurses Association to testify here on behalf of the bill, and I respectfully ask for an aye vote.
We have a motion and a second. Ms. Robertson?
There is a benefit for sitting through all of that. Chair in a second. Chairman Mainshine, thank you. Assembly members. Stephanie Robertson on behalf of the California Nurses Association, proud sponsor of the bill. I'm going to be really brief. More and more hospitals are placing patients who cannot be safely discharged in their homes to observation status as an alternative to hospital admission. In these settings, patients are sometimes placed for prolonged periods of time. Many patients aren't aware that they are in observation, leaving them to believe that they are admitted as inpatients, especially when they are in inpatient areas. This is especially concerning to patients who may need to be discharged to a long-term care facility, as Medicare requires patients to be inpatients for 3 days before coverage to long-term care will kick in. However, time spent in observation does not count as observation units or outpatient services. So this bill will do a couple of things. It requires staffing standards. It requires that there's notice to the patient that they are in observation, and it also requires reporting requirements to OSHPD. So I'll defer the rest of my time to my nurse, board member, David Welch from Inlow Medical Center. Thank you.
Hello. Thank you for the opportunity to testify. I've been a registered nurse for 35 years working with cardiac patients. During that time, a lot of things in healthcare have changed and evolved, some of them for the better and others not so much. For most of that time, the use of observation status in most hospitals was what any reasonable person might expect it to be. Patients where we needed a little more time to decide whether the problem they presented was worthy of admission. We needed to hold them for a few hours more to see how they responded to initial treatment, or wait for a test result to come back. Space in the ER is tight, ER gurneys aren't very comfortable, so we'd put them in a hospital room, but not actually admit them. Observation status. Now we're seeing a significant upward trend in the use of observation, more patients, sicker patients on observation for longer periods of time. And in many places, the creation of specialized observation units where patients look like they're hospitalized, feel like they're hospitalized, receive many of the same treatments as hospitalized patients, but because they're not officially admitted, are under a lower level of regulation and too often at a level of staffing not really appropriate for their condition. Depending on the way that the particular hospital handles observation status, those safety issues may or may not exist. I'm lucky enough to work at a genuine, independent community nonprofit hospital that handles the safety parts pretty appropriately, but there are some other problems for patients that are present pretty much everywhere that observation is used. The biggest issue of all for a lot of our patients has to do with what happens when they leave the hospital. With ever shorter hospital stays, a high proportion of the elderly patients that I see... What's that? Okay. Cut it? Okay. So anecdotally, I'm hearing stories from my colleagues at bigger chain hospitals of patients who ought to be on higher levels of care being inappropriately placed in observation units in ways that seriously endanger patient safety. We think it's fair that patients placed on observation status be informed when they're on that status and what that may mean to them in terms of their care and its costs.
Randy Hicks with California Alliance, Retired Americans in strong support. Californians for Disability Rights, Inc. in strong support.
Thank you. Further witnesses in support, name and organization only, please. Seeing none. Witnesses in opposition, please come forward.
Thank you, Mr. Chair. Excuse me. Tim Madden, representing Marin Healthcare District. Marin Healthcare District owns and operates Marin General Hospital, and our opposition to SB 1076 is around the staffing ratios that are dictated in the bill. We have no problem with the notification requirements or the reporting requirements to OSHPD. The nurse staffing ratios being set in the bill are for observation services, and the bill sets the ratio at a 1-to-4, so one nurse for every 4 patients, which is the same for emergency departments. The purpose of hospital staffing ratios is to establish the appropriate number of nurses for admitted patients based on how sick they are. Currently, ratios are in place for patients admitted are only in place for patients admitted in the hospitals. These ratios include a 1-for-2 ratio for critical care units, 1-for-4 for emergency departments, as I mentioned, and also a 1-to-5 ratio for med-surg units. Once again, these ratios are for patients who are sick enough where they need to be admitted or are in the emergency department. SB 1076 would set ratios for observation units, which are for outpatient services. These patients are not admitted into the hospital and are not in the emergency department. These patients are not sick enough to be admitted. On page 2, lines 5 through 8 of the bill specifically mentions that patients who have unstable or uncertain conditions, potentially serious enough to warrant close observation, but not so serious as to warrant inpatient admission to the hospital. So these are patients that we're talking about. At Marin, they average about 7 to 10 patients every day, which fall into this category. They are not sick enough to be admitted, but are not quite ready to be discharged. Most commonly, these patients come into the emergency department complaining of nausea or vomiting, vertigo, or chest pain. The role of the emergency department is to stabilize the patient and then get them to the next level of care. And essentially, it's do we admit them or do we release them? These patients are tweeners. An example would be a patient comes in with the flu. They've been vomiting for some time and are dehydrated. They don't need to be admitted because they're just not sick enough, but they do need some IV fluids, and the hospital wants to keep an eye on their vitals. These are low acuity patients who need to spend time in observation to get them feeling better so they can be discharged. The vast majority of patients at Marin Hospital who receive observation services are never admitted to the hospital. We believe the 1-to-4 ratio established in SB 1076 is too high given the low acuity of these patients. We see no correlation or reason to set the ratio at 1-to-4 for these patients, which is in place for patients in the emergency department, patients who are much more sick. We believe a more appropriate ratio would be a 1-to-6 ratio. This ratio more accurately reflects the low acuity of the patients receiving observation services in observation units. Today, Marin places patients in observation services wherever there's an open bed. It could be the med-surg unit with the 1-to-5 ratio or ICU with the 1-to-4 ratio. They would like to set up an observation unit to utilize these services, but at a 1-to-4 ratio, they would not do that because it's not appropriate and it would be excessive for their costs. For these reasons, we are opposed and we are asking for the ratio to be set at a 1-to-6 level. Thank you for your time.
Thank you. Further witnesses in opposition?
Support.
And or support?
My apologies. Sarah Flocks, California Labor Federation, in strong support of the bill.
Thank you. Any other witnesses in support or opposition? Seeing none, questions or comments from the committee? Seeing none, Senator Hernandez, you may close.
Ask for an aye vote.
Thank you. We have a motion. We have a motion and a second. Do pass to approach. Ask the clerk to please call the roll.
Wood? Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Campos? Chu? Gomez? Hernandez? Lackey? No. Lackey, no. Nazarian? Olson? Aye. Olson, aye. Patterson? Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? McCarty? Waldron?
Your item is at 3-1 right now, so it will be on call. Next is...
Mr. Chair, if you don't mind, a colleague of mine has witnesses that need
Sure.
to catch a flight.
Yeah.
Can I let Senator Ricardo go in front of
Yeah.
me, and then I'll come back and do the last two?
Mr. Lara.
If you don't mind.
Senator
Thank
Lara. No, it's great.
SB 1139. Thank you. I will be accepting the technical committee amendments outlined within the analysis, and also thank your consultant for the detailed analysis. SB 1139 will remove barriers for undocumented students pursuing medical profession careers by ensuring that all students, regardless of their immigration status, have access to the state scholarship and loan forgiveness programs for health professionals who work in medically underserved areas. In addition, the measure will clarify the eligibility of undocumented individuals who meet the requirements to apply and participate in medical school programs. The Health Professions Education Foundation is a statutorily created non-for-profit foundation that awards scholarships and loan repayments targeting health professionals who provide culturally and linguistically appropriate care within medically underserved areas. Currently, the foundation program application does not allow for the use of the individual tax identification number known as ITIN as a substitution for the Social Security number, despite the fact that we already allow the medical licensing boards to accept the ITIN number. This bill seeks to level the playing field for all California students and help the state increase providers in medically underserved areas. I respectfully ask for your aye vote.
Thank you. Witnesses in support, I'll give you up to 6 minutes, and you can divide it how you see fit.
Sure. Kimberly Chen with the California Pan-Ethnic Health Network, one of the proud sponsors of this legislation. Some of our witnesses need to catch some flights. So I'll turn it over to them, and I'm here to provide any technical support.
Thank you.
Good afternoon. My name is Eric Leyva. I am, aside from being here to testify, I'm also part of Pre-Health Dreamers, who is a co-sponsor on the bill as well. I immigrated to the United States from Mexico City when I was 5 years old after the passing of my father. My father, who was a medical doctor in Mexico, died while attempting to help a man from drowning. A few years after his passing, my mother made the courageous decision to immigrate to the United States in order to give myself a better opportunity as well as my sisters. Though due to limited funds, only my mother and I were able to immigrate to the U.S. In order to rekindle our small family, my mother had to work multiple jobs in order to raise enough money to bring our family together. I immigrated to Santa Ana, California, where I have called home for almost 2 decades. Once in the U.S., my mother worked multiple jobs in order to raise money to continue supporting us. As an undocumented immigrant, we have faced many hurdles along the way because of our status, like lack of fair wages, fear of deportation, and lack of healthcare access. These conditions have taken a toll on my mother's health, who doesn't have health insurance, but she's gone above and beyond to give me a better life. Despite all these obstacles, I recently graduated from UCLA, and I will be starting a pre-medical post-baccalaureate program this upcoming fall at Charles Drew University of Medicine and Science, where I will complete the required prerequisites needed for medical school, admission, As a physician, I intend to work in underserved communities throughout California, like those in Orange County, in order to assist with a shortage of healthcare professionals throughout the state and the country. Because of this, I respectfully urge for your aye vote on SB 1139, which would expand the eligibility of programs already in place, which would help me return to my community and serve those I intend to serve as a physician. Thank you.
Thank you.
Good afternoon, chairs and committee. My name is Marcella Zhou, and I'm currently a rising second-year medical student at the David Geffen School of Medicine at UCLA. I'm also part of their PRIME program, which is intended to train physicians to go back to underserved communities and serve in those areas as physician leaders. And I was granted DACA in December of 2012. In the 1980s, my parents immigrated from China to Mexico, and they followed this wave of immigrants that arrived in the city called Mexicali. They settled there, and my sister and I were born. Through my formative years, I was immersed into the Mexican culture, while inside the home, we maintained our Chinese ancestry as well. Seeking better educational opportunities, my sister and I left our home and moved to Calexico, California, right along the border of California. At the age of 15, because of immigration laws, I was physically separated from my parents and my family. And at that point, I became aware of my undocumented status as well. I struggled to accept my new identity as an undocumented immigrant in this country, but I focused on thriving academically instead, and I graduated as a valedictorian of my high school class in 2009 and went on to attend the University of California, San Diego, and graduated in 2012 with a bachelor's in human biology. Every day, I learn more about severe health and socioeconomic disparities that our country, and especially our state, faces, and especially the underserved communities. All these injustices remind me that I owe it to my community to not only be the best doctor that I can be, but also be an advocate and agent of change. I want to return to serve the communities that I come from, the Imperial Valley, the immigrants, the underserved, and the undocumented. This summer, I'm spending some time researching what's called the health physician shortage areas, and I'm just appalled and extremely saddened by the state of conditions in California, and I'm sure that's reflected throughout the states as well. Being a medical student is no easy feat, but can be much more challenging when you're constantly worrying about funding or whether you'll be able to continue your education. SB 1139 will empower aspiring physicians and other healthcare providers that have unmatched commitment to serve the most marginalized in our state. Because of this, I support this bill and respectfully urge your aye vote.
Thank you. Further witnesses in support, name and organization only, please.
Michelle Cabrera on behalf of SEIU California, including our Committee of Interns and Residents in strong support.
Linda Way with Western Center on Law and Poverty in strong support.
Beth Capel for Health Access and Support. Lydia Bourne, American Academy of Pediatrics in support.
Allie Fletcher with the ACLU of California in support.
Jody Hicks with the California Academy of Family Physicians in support. Really look forward to working with the students as physicians.
Sarah Linder with the National Association of Social Workers in support.
Lorenzo Valdovinos with Alianza, strong support, SB 139.
Tania Cruz with Alianza, strongly support.
Dr. Rhonda Rios Kravitz, President of Alianza, an immigrant group, in strong support.
Randy Hicks, Californians with Disability Rights, Inc., in strong support.
Any further witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Senator Lar, you may close.
Again, wanted to just reiterate that we've already in California. Do you want to?
I apologize. Thank you. I didn't see you, Mr. Lackey, that you had a question. Mr. Lackey.
A quick question for one of the witnesses who indicated they were working through the DACA program. Is there any idea about how long it takes to get citizenship through the DACA program?
There's currently no route through the DACA program to obtain citizenship.
Thank you.
Thank you. Now, Senator Laurie.
Thank you. No, I want to make sure we answer Mr. Lackey's question. Again, members, in California, we've already established that we can use an ITIN number for various the 40th boards and commissions that require for professional licensing. This, again, just closes a loophole for our medical students, ensuring that they have access to these programs. And, with hearing the testimony today, you can't deny that these aren't the best and the brightest California students that we have. So we want to make sure that they have some financial incentive to enter into already a profession that is definitely a dearth of in California. So respectfully ask for I vote.
Thank you. And we don't have a quorum at this time, so when a quorum returns, we'll take up your
Absolutely.
Your item.
Thank you.
Thank you. Next is Senator Hernandez. Senator Hernandez. Okay. I don't. I don't see Senator Morlock here. Okay. Senator Hernandez.
Thank you, Mr. Chair and members. This bill will address inadequate Medi-Cal reimbursement rates for ambulance providers by establishing a quality assurance fee on ambulance providers. I've carried a number of bills on this topic. The reason I've done so is because, unlike most other healthcare providers, they don't have a choice. They have to take Medi-Cal patients. The last Medi-Cal rate increase was in 1999, and rates were reduced by 10% in September 2013. The current basic life support reimbursement amount today is lower than the rate in 1999. I'm happy to accept the amendments referenced in comment number 6 in the committee analysis, and the sergeants are handing out mock-up. This bill is sponsored by the 911 Ambulance Provider Medical Alliance, which is a coalition of 6 of the largest ambulance providers. And with that, I respectfully ask for an aye vote.
Please go ahead with your witnesses there.
Johan Claes representing Paramedics Plus, which is Alameda County's 911 EMS provider. Paramedics Plus provides about 100,000 transports per year. 16% of the patients have commercial insurance. The remaining 84% are financed by other ways, but about 36% are Medi-Cal. Paramedics Plus supports this as a way to close the gap in the terms of the financial stresses that the county ambulance systems have been experiencing that are served by private ambulance companies.
Jason Sork with American Medical Response and also with the Medi-Cal Coalition here today to seek your support for SB 1300 and answer any questions you might have on the bill.
Great, thank you. Others in support, please name an organization.
Thank you. Catherine Brandenburg, representing the County of Alameda Board of Supervisors, in support.
Thank you.
Megan Brightwell on behalf of the California Professional Firefighters, in support.
Thank you.
Betsy Armstrong with the EMS Administrators, in support.
Thank you.
Mr. Chairman, members, Rob Fine for the California Fire Chiefs and Fire Districts Association, in support.
Thank you very much. Anyone else in support? Anyone in opposition? Seeing no one, come back to the committee. Questions, comments? Anyone? Happy to let you close, Senator Hernandez.
Ask for an aye vote.
Thank you very much. Madam Secretary, please call the roll. This is due pass as amended to appropriations.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Campos? Chu? Gomez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Olson? Olson, aye. Patterson? Ridley Thomas? Rodriguez? Santiago? Steinnorth? Waldron. Oh, I'm sorry, McCarty. Waldron, aye.
The vote is 5-0. We'll leave that open. We need 5 more. Moving on to SB 1365, Senator Hernandez.
Thank you, Mr. Chair and members. This bill was originally drafted to prohibit hospitals from charging a facility fee for service in outpatient clinic. However, in response to concerns, the bill now only requires a disclosure. And with that, I respectfully ask for an aye vote.
Mr. Chairman and members, Barry Broad on behalf of the Teamsters, we're sponsors of the bill. I just want to just quickly tell you this problem that this bill resolves happened to me, which is I was getting an injection that in my knees for a condition known as aging, and they simply informed me that it happens every 6 months, that they were changing the location of the outpatient clinic from one office building to another. After the injections were done the second time, the bill that went to my health plan was, and there were a series of 3 injections, a $2,000 per injection facility fee. So it was $6,000 to the health plan for exactly the same service. I had no knowledge in advance, no warning. And in the end, when I said, what happened? They said, well, it's a hospital-based facility fee, but if you travel to Elk Grove, we have another doctor's office where you could do this where there wouldn't be the facility fee, but it's too late. And so all this bill does, it would have been perfect to solve that problem. They would have had to say, yes, we provide that same service without the facility fee. Here's what the facility fee is, and here's if you choose to go someplace else. So it just enables patients to do what we want them to do, which is be smart patients. So we urge an aye vote. Thank you.
Thank you very much.
Beth Capel on behalf of Health Access here in support and to answer any questions.
Thank you. Others in support?
Michelle Cabrera with SEIU California, in support.
Thank you.
Sarah Flocks with the California Labor Federation, in support. Thank you.
Great, thank you.
Mr. Chair, Alex Hawthorne on behalf of the California Hospital Association thank the author and sponsors for working with us. We are neutral on the bill.
Thank you.
John Winger on behalf of America's Health Insurance Plans. Apologies for not getting the letter in time, but we are in support.
Thank you. Anyone else? Seeing no one. Anyone in opposition? Seeing no one, bring it back to the committee. Questions or comments? Just one, I'd like to get whatever that anti-aging drug you're getting injected into your knees. I'd appreciate that, Mr. Broad. Tell me what that is. With that, I'll turn it back to Senator Hernandez.
Just in close, I don't think there's any drug that will help Barry Broad.
Fair enough. With that, Madam Secretary, please call the roll. It's due pass to appropriations.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke, Campos, Chu, Gomez, Hernandez, Lackey, Lackey I, Nazarian, Olson, Olson I, Patterson, Patterson I, Ridley Thomas, Ridley Thomas I, Rodriguez, Santiago, Steinnorth, Steinnorth I, McCarty, Waldron, Waldron I.
That is eight. That is eight to 0. We'll need a couple more votes. We'll leave the roll open. Senator Morlock, it seems like minutes since I last saw you. Thank you.
Thank you for also enjoying a nice long day here at the Capitol.
Just different rooms is all.
Just different rooms, but all good. I'm here to present Senate Bill 1273.
Move the bill.
Please proceed.
I'm hearing hints, so I'll keep it real brief. Last night I was watching the news. I saw two mental health crises on the digital world. One was on a Virgin Airlines flight where a passenger got up, started opening all the overhead compartments and riddling through the suitcases while everybody was watching. That's a mental health crisis. Another one was a homeless person who snuck into a vegan restaurant after hours, found the powdered sugar, and proceeded to pour himself all over with that's a mental health crisis. We need facilities to help these people when the public safety officials come along. And Mr. Chair, that's all we're trying to do is use a little bit of Prop 63 funding to accommodate and provide for this need. So it's a simple bill that clarifies that Prop 63 funds can be used for crisis stabilization services that are designed to be involuntary. In this process, we've worked with numerous partners, including the Steinberg Institute, County of Orange, County Behavioral Health Directors Association, and numerous legislative colleagues, including Senator Hertzberg and also former State Senator Steinberg as well. It's been a real fun process. I also want to thank you for your assistance, and I want to also personally and specifically thank Paula Velasquez for all of her hard work. I want to embarrass her if I can. But I have two wonderful witnesses with me today, Mr. Chair. I have Anna Hasselblad she's the Director of Public Policy for the Steinberg Institute, and I also have Mary Adair with the County Behavioral Health Directors Association of California.
Thank you. Please go ahead.
Good afternoon, and I will keep it brief. I already scribbled out some of my talking points. My name is Anna Hasselblad with the Steinberg Institute. SB 1273 is really a clarifying piece of legislation, and it really will allow for more seamless transitions in care for an individual in a mental health crisis, allowing them to access the appropriate level of services, and then as they enter into recovery, step down more fluidly to lower levels of care. In being able to co-locate voluntary Prop 63 funded services with involuntary services funded otherwise is a core component to that step-down care being successful. We also know that emergency rooms in jails are incredibly overburdened across the state dealing with mental health crises, and this will also allow to build capacity in the state of California for crisis services that are sorely needed. And this just creates the clarity and authority for counties to use Prop 63 funding to further those services. And I ask for your aye vote.
Thank you. Go ahead.
Good afternoon. Mary Adair with the County Behavioral Health Directors Association. We're here very pleased to be in support of SB 1273. We appreciate the author's work on this. This clarification in current law will allow us to continue to build our crisis stabilization services and reduce impacts on ERs, inpatient units, and jails. So it's a very important component of our continuum of care. And this this component is in particularly high demand, especially among the homeless.
Great. Thank you very much. Others in support?
Alex Hawthorne with the California Hospital Association in support.
Thank you.
Nisette Short on behalf of Adventist Health and Loma Linda University Health in support.
Thank you.
Nicole Wortelman on behalf of the Orange County Board of Supervisors in support.
Thank you.
Lydia Bourne, American Academy of Pediatrics in support.
Thank you.
Tracy Ryan, Rural County Representatives, support.
Thank you.
Elizabeth Marsley on behalf of the California State Association of Counties and the Urban Counties of California in support.
Thank you.
Angelica Gonzalez on behalf of Kaiser Permanente in support.
Thank you.
Asha Harris on behalf of the California State Sheriff's Association in support.
Great. Thank you very much. Anyone in opposition?
Rain Hicks, mental health client, also with a member of the California Network of Mental Health Clients and California's Disability Rights. So we'll read what Disability Rights has wrote here. She can't be here, unfortunately. She's left. Disability Rights California states that this bill would allow Mental Health Services Act funds to be paid for involuntary hold facilities. Any use of mental health services funds for crisis programs must be voluntary, furthering the purpose of the Mental Health Services Act to be used to expand mental health services and not used to supplant funding from other sources. DRC argues that a change in the statute may not be necessary to fund voluntary crisis intervention programs. And as a mental health client, I have really big problems in involuntary hold facilities. I have been in one. I can tell you that what they did with me was they put me on drugs that I didn't need to be on. They think they can determine what your mental health is, and they don't. And I appreciate what he's doing here, that we need to keep more people out of jail and keep people off the streets and get them treated. But are they treating them the right way? And voluntary is what it's all about. Mental Health Services Act money is used to expand programs, new programs, not to fill in the holes of existing programs because of past cuts. So I, as a citizen and as a member of California's Disability Rights, I strongly oppose this bill.
Thank you very much. Is there anyone else in opposition? Seeing none, bring it back to the committee. Questions or comments from the committee? Seeing none, Senator Morlock, would you like to close?
Thank you, Mr. Chair. Mental illness is a pretty serious issue that is kind of covering the front page of the LA Times almost every day the last 2 weeks. It's a big issue in Orange County. We were able to work with Darrell Steinberg 3 years ago to get a bill passed to allow a little bit of Prop 63 to help us implement Laura's Law to help families with kids that were straying or were in jails, and we're trying to provide remedies. We just approved as a state senate on the floor, and you may have as well on the assembly floor, No Place Like Home. Again, a collaboration with former Senator Steinberg to provide some assistance, and this is in the same vein. We're trying to fix issues that are critical to the citizens of this state, and I respectfully request an aye vote.
Well, thank you, Senator, and thank you for working on this difficult project and difficult topic, and thank you for working with our committee as well.
Thank you.
Bring back to the committee. Is there a motion? I'm sorry. It's been a long day. We have a motion. We have a second. Madam Secretary, please call the roll. The motion is do pass as amended. Chair's recommendation is yes.
Wood?
Yes. Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Aye. Burke, aye. Campos? Chu? Gomez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Olson? Aye. Olson, aye. Patterson? Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinort? Steinort, aye. McCarty? Waldron? Aye. Waldron, aye.
$11-0. You're the first bill out today. Congratulations, Senator Morlock. It was worth the wait.
and thank you, Paula.
Okay, we have two authors we're still hoping to that can find their way here to see us this afternoon. I'm sorry. This is Mr. I'm sorry. My bad. Laura. My apologies. I can't count very well. So we're Mr. Leno. We're still waiting. We're just waiting on Mr. Leno. I'm sorry. I can't hear.
He said he would present it for him.
He'll be up. Why don't we go through? The other items? Can we call the members? Consent count. Okay.
Okay.
The consent calendar has been moved. Consent calendar consists of ACR 198. It's item number 1. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Chu? Gomez? Hernandez? Lackey? Lackey, aye. Nazarian? Olson? Olson, aye. Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. McCarty? Waldron? Waldron, aye. 12-0.
The consent calendar is out 12-0. We'll leave that open for other members to add on. We'll start going through the bills at this point. Item number 2, SB 586. Is there a motion? Was there a motion on it? We'll need a motion. A motion by Ms. Olson, a second by Ms. Waldron. The motion is due pass as amended to approps. Madam Secretary, please call the roll.